Hello and welcome to State View. I'm Mark Crosby. Thank you for joining us. A program today, and as in programs past, a program like this specializes in legislation that is happening on Beacon Hill and helps you to stay informed and how it affects you living throughout the Commonwealth of Massachusetts. So joining with me in studio today is Senator John Keenan. He is the senator from the Norfolk and Plymouth district here in the Commonwealth of Massachusetts. So, Senator, welcome back.
Great, Mark. Great to be here again. Thank you.
It's always a pleasure to have you. There's always been a lot of material to discuss, so this will be kind of heavy on the legislative side, which is what the folks at home have come to expect, I suppose.
Great. No, that's great. We love to share the information. I think it's important that people know what's going on in state government. So, glad to be here, and whatever folks want to cover, that's fine with me.
Great. All right. Well, we're going to start with healthcare and talk about specifically continuing care for multiple sclerosis.
Yes, that's a bill we filed. One of the things that we've learned from people is, people who have MS, is that if there's a change in their insurance, a change in deductibles, a change in copay, or if they change job that results in a change in any one of those things, that oftentimes they're asked to go off the medication that has been working for them and to try something new because maybe the medication they're on isn't covered under their new insurance. So this legislation is designed so that when somebody with MS finds the right treatment, they will have access to that treatment regardless of any changes in their insurance. So if they switch a job, their insurance must cover the treatment. If there's a change in formulary by one insurer, they will still have access to that treatment. And we did a briefing at the State House a couple of weeks ago, and Peter in my office put together the stories of people who are dealing with MS, and their stories were so compelling about why this legislation is necessary. So we're going to continue to push the bill to ensure that people with MS have access uninterrupted to medications that work.
Makes a lot of sense.
It does. It's you hear the stories about people when the medications have changed. With MS, medications basically slow the progression of the disease. And if you switch your medication and you regress, you generally don't make up what you've lost. And so it's so important to keep people on the right medications.
And the timeline is extremely important, as you just mentioned.
Yes, absolutely.
An act to ensure more affordable care.
Yeah, so this is legislation that we've filed with the idea that there are some diseases, some medical conditions for which medication and treatments are required, and yet they're so basic and they're so important. And sometimes the barrier to those medications, those treatments, prevents people from accessing them. And the result is that their condition worsens and they have to go to an emergency department, maybe get admitted to a hospital, and then the cost of all that is so much greater than the cost of providing those medications at the outset. For instance, diabetes is an example. Access to insulin is just so necessary. It's come to be expected, and yet for some people they can't afford it. And if they go without that access, they end up going to an emergency department, being admitted. So this would basically result in there being no copays for conditions of diabetes, asthma, COPD, hypertension, coronary artery disease. Those types of diseases, access to medications would be without copays and without deductibles. And also, we always measure healthcare cost from the provider's perspective. Oh, the cost of providing this has gone up. Hospitals are charging more for this. And we think it's important that we take a step back and see what is the impact on consumers and be worried about what we're asking consumers to pay. And so this legislation would basically put into a place a consumer growth cost benchmark. And it gives a different perspective on the experiences of people, how they're interacting with the healthcare system and what it's costing them. So there are other components to the legislation, but those are the basics of it. And then there's a reinsurance piece that will help people with insurance companies move on the cost of some of the more serious cases that they have to deal with, and that will help everybody in terms of lower premiums and deductibles and copays.
And there's also an aspect in here regarding small business assistance?
Yes, so the idea would be to keep the costs as low as possible for small businesses, and for instance, by moving the reinsurance, by allowing for reinsurance, small businesses who get their insurance policies, one of the things that really spikes their premiums is all of a sudden an employee comes down with a serious medical condition. And if you have 25, 30 employees and one has a serious medical condition, that can raise the cost rather dramatically. So there'd be the ability within the bill to kind of move that cost onto the next level of insurance, and that will work to keep a cost down for local businesses. And I remember when I worked in city government in the mayor's office, we were self-insured, and there was a few cases that were very high cost for the city of Quincy. And so this is the same thing. You've got to find a way to kind of keep those costs down as low as possible.
And also the ensuring that the availability of like a $0 health plan for low income and basically connector care members.
Yes, there's so many people that they kind of fall between being eligible completely for Mass Health and not being able to pay private insurance or not having access to private insurance through an employer. And so the connector plans are really critical to fill that void, and trying to keep those costs as low as possible as well is really important for the same reasons. You want people to be proactive in their health, to get their checkups, to get the routine care so that they don't experience major health problems, and then that avoids the system having to absorb the costs associated with a major health issue.
We will now move on to mental health and substance use and talk about dual diagnosis treatment coverage.
So one of the things that we've come to see is that the relationship between mental health and substance use, the correlation between the two, or the connection between the two is quite dramatic. Many people who turn to substances are dealing with mental health issues and are looking to self-medicate, and many people who get involved in substances end up spiraling down and having some mental health issues as well. So the two are very closely related. But our system is set up to treat them differently or separately. So you could have a substance issue and go into a detox, and even though that facility that you're in might be equipped to handle the subsequent mental health issues, they may not be approved to do so, or the insurance company may not provide it. So this simplifies it, but you may go into a detox and they say, okay, the person's detoxed, and all the mental health issues come rising to the top, and they're equipped to handle them. They said, but you're going to have to go down the street to get that treatment because the insurance companies won't pay for it.
It's a roadblock.
It's a roadblock. And so whether you go in from mental health treatment and need substance treatment as well, you could get it at one place knowing that your insurance company would cover it, or if you're in for substance treatment and mental health issues surface, it could be paid for there. I remember going to Framingham State Prison and talking with the folks out there, and that's where they used to send women for Section 35 involuntary commitments for substance use. And they said, when we detox somebody, all the mental health issues just come flying to the top. We can get the substance from somebody's body, and then all the issues that cause somebody to use the substance come to the surface. And so it's important to treat the whole person.
It's all connected.
It's all connected, and that this legislation is designed to connect the treatment for that. So
makes a lot of sense.
We'll see,
Absolutely.
hopefully.
Well, it makes a lot of sense. I mean, talking about it and thinking about it, it's there are very few single lines in life.
Yes, I know.
Let's
That's
talk
true.
about children and mental health services.
That is a problem that has become so acute during the pandemic. There are issues with children in school, out of school, being isolated from their peers. Even if they go to school in the normal course now, they go home and it's still an environment where they're not out interacting in sports leagues and music programs like they were. And so the stress of all that, particularly for children who may be vulnerable to mental, more inclined to deal with mental health issues, it's just exacerbated, has been exacerbated. So the goal of this legislation is to make access to the mental health system as easy as possible for children. One of the things that it does is it sets up an ombudsperson's role so that somebody can help somebody, a family who's struggling with a child's mental health condition, kind of connect the dots and know where to go, know what resources are available. It would also help with the issue of boarding in the emergency department. It is a problem with adults, and it's even a more significant problem with children. And sometimes children will board at some of our hospitals for a long time. And by boarding, meaning they're in need of mental health care, but they're just basically kept in an emergency department until a bed opens up. The Senate has recently passed some legislation, and the House will take it up, and hopefully we'll get it to the governor, that will address some of those ED boarding issues by having bed searches done real time so people know where beds are available and where they're available. So there's a lot of work going on, but making sure that children have access is so important.
Recovery coaches.
Yes, going back to the pandemic again, the pandemic has highlighted how good the programs we had in place were. We didn't have enough because we obviously had a pretty significant substance use issue going on pre-pandemic. That has gotten worse. While we were trending in the right direction, not fast enough or not to the extent that we hoped, we were trending in the right direction in terms of dealing with overdose deaths, for instance, and rates of overdose even. And all that has been turned upside down with the pandemic. And so recovery coaches are critical in providing access to people, being accessible to people to help them. Almost like AA has sponsors, recovery coaches fill a similar role, that they will have been through substance use issues before, they have recovered, they are able to pass that on to those that are in need. And the willingness is incredible, and the experiences they have make them particularly well suited to provide recovery coaching, but insurance companies won't cover it. So this would professionalize that field, require licensing, certification, and then insurance companies would pay for it. And the goal is to attract people with lived experience who are willing to help others and make a decent wage while doing so.
That certainly makes a difference to be able to relate to whomever you're providing the service to.
Yes, it's no secret. It's been so effective in AA for so long, the sponsor program, and we need more of it on the substance side as well. And recovery coaches with that lived experience are invaluable.
Let's now turn to transportation and the environment, and we'll look first at an act relative to commuter transit benefits.
Yes, so in a nutshell, the way the federal tax code is set up, it really benefits, it provides a tax benefit for commuters, but it favors those who commute by automobile more than public transportation or even bikes. So with this, we want to make sure that the benefit here in Massachusetts matches the federal benefit, matches the federal tax credit, and that there is an emphasis on promoting public transportation so that things like T-passes are covered. And also, our goal is to include bicycles as well, so that you can get a tax credit if you are using a bicycle for commuting purposes. And more people are doing that. So we want to get as many people as we can out of their cars onto public transportation. That's good for the environment, and ideally to get people out of their cars and on bicycles, where it's not only good for the environment but good for people's health. And of course that means investment in bicycle lanes and making sure that we have all those things in place. But I've been to many places where bicycles are used extensively. And it hit me up in Montreal one time. I was standing on a street corner. It was quite cold outside, not what you consider normal biking weather around here. In Montreal's weather's even worse.
Right.
And I was standing on a street corner, and I looked back, and there was about 50 bikes all in line waiting in a red light in a bike lane. And I thought, imagine if that was 50 cars, that would stretch back 4 or 5 blocks. And the 50 bikes went back half a block. The light changed, and they swept right through. And it showed that bicycles can be integrated with automobiles if it's done properly. And the commuter tax credit promotes public transportation and promotes the use of bicycles and makes sure that people are getting the appropriate credits for that.
I do think that there really needs to be some kind of education, public service announcement or program about bike lanes and how they're supposed to be used too, for both cyclists as well as folks in vehicles.
Yes. When I hear from a lot of people, when you talk about bicycles, they'll say, people who ride bicycles follow the rules of the road only when it benefits them. That they don't always stop at red lights. They don't adhere to using the signals that they should use. But I think bicyclists have gotten so much more responsive to integrating with traffic and more responsible. And the more we can do on dedicated bike lanes and education of both drivers and bicyclists, I think it's better for everybody. It makes bicycling safer, because the bicyclists will tell you they follow the rules, and most of them do. They follow the rules, and a door opens up, or a car takes an unexpected turn, and it's very dangerous to the bicycle. So it's education on both sides and providing the investment and then the financial incentives as well.
talking about disability rights, equal access to medical treatment, essential for people with developmental or intellectual disabilities or autism.
Yes, we've been involved in this type of work for many years now, and this legislation focuses on the issue of applied behavior analysis. It is a treatment method or a way to help people with severe autism or other developmental disabilities. And some people think it's the best way to do it. Other people don't think it's the best way at all. But presently, there's not coverage for people over the age of 22.
I was going to say 18 and under.
Yes. Yeah, they have pretty ready access to it in most cases. 18 to 22 it wanes, and then typically when somebody turns 22, then that's a pretty clear mark of some of these things not being covered.
Okay.
And so this legislation is designed to make sure that if ABA is appropriate for an individual, and it's not appropriate for every individual, it may not be the best course for everybody, but it's a proven method for some people that they have access to it. It's almost like in substance use treatment. For some people, AA works well. For some people, going through detox and step down works really well. For other people, medication-assisted treatment works well. And for the most part, we cover many of those on that side. But when it comes to developmental disabilities, we don't have the same access to the number of programs that are available. And this legislation is designed to equalize that access.
And looking at education, an act to create a facilities program for private special education schools.
Yes, so we in Massachusetts, for many students that have developmental disabilities, who have mental health issues, who have learning needs that the local school community cannot meet in-house, many of them end up going to our Chapter 766 schools, our special education schools. And they are kind of an interesting mix. They charge tuition to the community that is sending the student, and that's not always sufficient to cover the cost of running these schools because they're very expensive because of the unique needs. So they have to do a lot of fundraising. So they're in between this area of private versus public schools. I look at them as the students that go to these schools are our students. They're our children, they're our students, and they should have the same access to a good quality education. And so one of the areas where that doesn't happen is when we pass a bond bill or we fund the Mass School Building Authority's program to build a new school or to do something within our schools, we oftentimes don't make those same resources available to our 766 schools. And so we'd really like to make sure that they have the same access to bond programs, to borrowing opportunities, so that they can improve their facilities and to ensure that the students that go to those schools have, again, the same access to a quality education as every other student. Quincy's kind of taking a different approach. Quincy's going to be doing some of this in-house at the DeCristofaro, and I think the Learning Center. I'm not sure what the full name is, but so that's a unique approach. But a lot of school systems don't have the resources to do that, and so this levels the playing field. Every student in the Commonwealth of Massachusetts should have access to an education of equal quality, equal access to an education of equal quality, and that's what this legislation is designed in part to do. We try to do it for computers, for facilities, you name it. We try every time to get as much funding for these schools. We've been successful in some attempts and not successful in others. I think we should be doing it across the board.
There was a recent housing committee meeting, so we'll talk a little bit about what was discussed during that committee meeting. Rent control is one of the issues, one of the items that was talked about.
Yes, we had a hearing that I think went 7+ hours, and the main issue was rent control. Massachusetts used to permit rent control in the Commonwealth. It was utilized in a few communities. There was a ballot question that narrowly passed that basically banned rent control in Massachusetts. Some communities are looking to institute it again by local option, meaning that they as a community could vote to institute rent control. And you need state authorization for a community to do that. So Cambridge, Somerville, those are the communities and other in Boston that are really interested in doing some form of rent control. So we had a long hearing on it. We got testimony mostly from those who are in favor of rent control. There's a significant number of people who are opposed to it. But it was good to get the testimony. What's driving it, and whether you believe in rent control or not, What's driving it is that rents are out of control here in the Commonwealth of Massachusetts. It's a function of we're a popular place. People want to live here. Our economy does pretty well. People are employed. Our unemployment rates have been dropping. So those are all good things. So it increases the demand for housing. And we just don't have enough housing. We are short several 100,000 units in the Commonwealth. And so rents go up, competition for those units increases, and people being priced out of the market.
And yet you see a lot of building going on, not only in Quincy, the surrounding towns as well.
And they're filling up like that. In
Right.
Quincy, for instance, I often hear from people, how are they ever going to fill that building? And I sometimes wonder myself. For instance, the Abbey in North Quincy, which recently opened, beautiful units, some nice amenities, directly adjacent to the MBTA station, but it was built during COVID. And I thought, how are they ever going to fill the nearly 600 units that they can have there? And they are filling up very quickly, and my understanding is that they expect they may have the units in the second phase rented out before they even finish the building. I was down in Attleboro with what they call the Gateway City Caucus, looking at some housing developments down there, and near the commuter rail station they had the same situation. Literally when they cut the ribbon, the building was full. So there's such pent-up demand for housing, so we have to do the best we can to make sure that it's affordable and accessible to people.
Another item on the agenda that during that hearing, tenant protections.
Yes, so what's happening in a lot of places, and there's a lot of discussion about the best way to handle it, is that a lot of these apartment buildings are being converted into condominiums, so tenants are being asked to leave, and there aren't enough units out there. Rents are going up, as we talked about. So there's a lot of discussion about what's the best way to make sure that tenants are protected in this process. Is it by making sure that they have access to legal counsel? That's one tenant protection. Is it by ensuring that they get adequate notice as long as possible before they have to leave a building that may be planned to be converted from apartments to condominiums? Is that something we can do for tenant protection? Is there a way to give tenants the opportunity to purchase the building if it's being sold? Purchase it at market rate, not at a reduced cost. So if a landlord puts a property in the market, is there a mechanism where the tenants basically can raise their hand and say, we'll form an association, we want to buy it, and we'll pay you the same price as that developer is looking to pay you. But it'll keep it nearly as affordable as possible for us. So all those types of things are out there in terms of trying to provide protection to tenants. And we're trying to strike the balance of making sure that tenants are protected, but that there's still enough incentive in being a landlord to provide good quality housing for people at a reasonable rate. You can't deny a landlord a profit of some sort. They're not going to run a building for free. So, it's making sure that we find that balance. And I think long term, the balance lies in making sure we have enough units available for people. That's the natural equalizer. Enough units to meet the demand. Landlords make their profit, tenants pay a reasonable rent, and there's enough units for tenants. That's a ways to go, quite honestly, but that's the goal.
And also, I'm sure the pandemic has played a part in housing, and as a result, was probably brought up during the Housing Committee's hearing as well.
Yes, so what we found in some of the communities is because housing is so tight, many people are living together, and that resulted in a greater spread of COVID. And it highlighted the need to make sure that people have proper space. Our health codes basically provide that there has to be so many square feet per person within a dwelling unit. And that was designed in part when those were first introduced years and years ago as a public health measure, because people living in close proximity are more likely to pass diseases, and they're more susceptible to getting some of these viruses that have surfaced throughout history. So that's the purpose of it. And so really we've got to find a way again to provide enough housing so that there's enough space for people that they're not living in cramped quarters and creating more of a public health risk to themselves, a health risk to themselves and a public health situation.
In just the last couple minutes, Governor Charlie Baker gave his last State of the Commonwealth address the other evening. Just maybe a takeaway from his remarks that evening?
Yeah, I thought he did a fine job. He highlighted some of the successes of his administration. And while I have not always agreed with the governor on every policy issue or his approach to every policy issue, we have agreed on many. Opioids were an area where we've worked closely together. More recently on housing and transportation, I've worked with him and his administration closely. Oftentimes agreeing, sometimes disagreeing. But one thing I would say about Governor Baker is that he went to work every day and he brought with him an acute intelligence, very bright guy, a really solid, incredible work ethic. He was honest, and he was genuinely interested in doing good. There wasn't ambition to become president of the United States. He went to work with the idea that he was going to try to help the people of the Commonwealth every day, and he brought his intelligence, his work ethic, his honesty, integrity, all things that we so desperately need in government these days. So you can disagree with him on this policy or that policy, on the character of the individual and his commitment to helping others. I think that will be the hallmark of his administration and his service. And he touched on the climate of government these days in society in his last segment of his address, and it was really well done. I think he laid it out there that we've got to get along. We have to work with each other. We have to recognize we have differences, but work to get beyond those and to move things forward for people. And I thought that was the most compelling part of his address.
Quite clearly, the opposite of that, nothing gets done.
Correct. And he realizes that. And again, you can have policy differences. I don't agree with everything Governor Baker's, the way he does things, agrees. But if you have that basic goodness, I think it was John Adams, one of his statements was, to be good, to do good is all we have to do. And it's so true. And we've lost sight of that. Just be good, look to do good, and we'll be all right. And so the more people we can get involved in government with that belief, we'll get through this period that we're in nationally where it's very difficult. Hopefully we'll keep that type of atmosphere out of Massachusetts, and we'll continue to move forward here and be a kind of a symbol to the rest of the country that you can work together and get things done while still disagreeing.
I was going to say that. I think the Commonwealth has done a great job and should actually be an example of what could be done at basically at Capitol Hill.
Well, we were in session this past Wednesday, and I was in the chamber, and Bruce Tarr, who's the minority leader, the Republican leader of the Senate, he's just he wants to get things done. He wants to solve problems, and he's willing to sit at the table and compromise, and thankfully the Senate's majority party is willing to do it with him. And I look at him and say, he's somebody that the rest of the country should look at as from the Republican standpoint. And there's Democrats who are doing the same thing across the aisle in Massachusetts. And if the rest of the country just took and said, yeah, they don't always agree, but they sit down and they talk about it, they disagree, they move on, they come to areas of agreement, they have a couple laughs in the process. That's how you move things forward. And we're fortunate in Massachusetts, and I hope we continue to succeed in keeping all that other stuff out of here.
Well, on that note, I think we'll end this program. We're coming up to the half hour. I want to thank you for joining me here at Quincy Access Television. And of course, throughout the Commonwealth, this program will be available to access stations to air as well.
Great. Thank you. And thank you for the opportunity to get what we're doing in government, the word on what we're doing out there to people, because that's just as important as anything else too. So thank you for doing it.
Thank you for thanking me. And thank you at home for watching. And just please remember to support your local access television station so that you can see more programming just like this.